This is Dr. Rowe, Chief Neurologist at the RNI. I hope you're able to do all your homework on the previous series, because otherwise this will seem like drinking through a fire hose. But healthcare is complicated, your body's complicated, it's the most complicated and complex machine in the entire known universe. So it's kind of worth getting to know better if you're going to help yourself with these problems that we're dealing in this video series. There's no 10 easy steps. I know there are no 10 easy steps because I've written a lot of articles on 10 easy steps or 7 easy steps to do this or that. But when it comes to the kind of things that we're talking about in this video series, there are no 10 easy steps. The only easy day was yesterday, as some of our compatriots are fond of saying. So let's talk about neck and back problems first. Update on neck and back problems. Surgery and invasive pain management continue to be way overutilized in this country. Hospitals continue to be reimbursed for mistakes, and sometimes surgeons are paid on the back end for the equipment that they put in. So, one rule of thumb: never ever see a surgical subspecialist before you get your back pain evaluated by a non-surgical subspecialist. Just makes sense, right? I mean, if you want to get rid of you want to fix your car, you're not going to go necessarily to a dealer or to the junkyard. You're going to somebody who's a mechanic who can help you fix it. The diagnostic principles are really the same. Basically, history and exam, as we talked about before. Let's take a look at the neck here. Again, you're interested in history and exam, and all these little nerves coming out of here are reflected in the neurologic exam. Pressure on them causes pain. And so you need an x-ray to look for mobility with and without weight bearing of this spine. If we take the muscles away and we go down to the nerves, you need to know if there's any increased mobility of the spine for various reasons that we'll go into. If there's causes for arthritis, or these little facet joints. So you need x-ray to do that. You need it with and without weight bearing, and this is true for the neck or the back. An EMG, though, an EMG is a neurologic test, and it will help your neurologist actually determine whether or not the nerve is pinched and where it's pinched and what level, and whether or not you have a pinched nerve elsewhere in your body, like in the rest of your arm or the rest of your leg, causing numbness. It'll tell your neurologist how badly it's pinched and whether or not the body is keeping up with its destruction, and whether or not there's something else going on too. So it's a physiology test, a test of nerve function. And then finally, the MRI is the gold standard for looking at problems with soft tissues, for finding out exactly what's pinching a nerve, and why, and what the structural problem with the nerve is. And so this is just the way it works. None of these three tests can be used in isolation. None of them is worth anything without a decent history and exam. So they're not perfect, but put together with the history and exam, those three tests will help your clinical specialist know how best to treat you, how to design a treatment program for you. Now, I'd like to talk about something that's just recently been recognized as a problem. It's really been a problem ever since ever since we've been on the planet. But it has to do with hypermobility and the genes that set up the connective tissue of your body. These connective tissues around the disc, the little jelly donut part of the disc, the donut part, are vulnerable to the same tissues, the same tissue abnormalities that you have elsewhere in the body if you're hypermobile. Hypermobility syndrome is a hodgepodge right now Most severe parts are Ehlers-Danlos syndrome on one side of the spectrum, but there's other, they're much milder, milder hypermobility syndromes. And we don't know the genetic defects in all of them. They all have something to do with the extracellular matrix and the ligaments that support our joints across, that support our bones across the joints of our body. Some common tests are a Beighton score, and that involves can you oppose your thumb to the forearm? Can you hyperextend your pinky? Do your elbows hyperextend? Do your knees hyperextend? But this same defect is present not only in those joints. Not only does it lead to increased trauma of the joints, but it also leads to easy herniation of discs. And it also leads to collapse of the airway at night to cause something like upper airway resistance syndrome. So these connective tissues of the body are present really throughout the body, but this hypermobility has profound impact on the quality of life. So it can lead to joint pain, pinched nerves. It can lead to collapse of the airway when you're trying to breathe at night. We cover that in another one of our another update. But it's the body's a very complex organism. Surgery won't work on you if you have if you have a generalized defect in connective tissue. Then why would you think that surgery on one particular level or second level or multiple surgeries fusing your spine up and down your neck and back is going to do anything for you? It requires different strategy, a very different strategy. But first of all, it has to be recognized. And the damage that is done already has to be quantitated and relieved to some extent. So I hope you get an idea about some of the major developments in neck and back pain, the reason you never want to see a surgeon first. And the final thing is never let anyone ever crack your neck. And I want to show you why. If you look at the neck, it's the same kind of complex structure that's present in all the rest of the body. So if you start stripping off the layers, you see the muscles here underneath, and then you start to see the laryngeal structures, the epiglottis, the skull underneath, and you start to see arteries and veins. And if you rotate around this way a little bit, you'll see that there are 4 major arteries that go to the brain. 2 of them come right up what's called the lateral masses of the neck vertebral bodies. Right up through here. These arteries are right here, the vertebral arteries. They go into the major hole in the skull where the spinal cord and all the sensory information shuttles back and forth between the brain and the rest of the body. And the vertebral arteries supply some very high dollar real estate here. And they go right between the vertebral bodies. So what happens when you crack your neck is you actually stretch those arteries. I've seen deaths and quadriplegias and a lot of problems with people trying to make hypermobile people who have those connective tissue defects in their arteries also more mobile. When what's needed is a very different strategy. Never let anyone crack your neck. You're always going to be coming back for manipulations, and frankly, the good people that I know now don't do that anymore. That's the old-fashioned think. They know that they can cause more problems than they can help you with. So I hope you take these little tips, this little introduction and even update of the complexity of the human body and the nervous system to heart. Hope you'll spend some time with the earlier videos because they are the building blocks. It's like learning addition and subtraction before you learn algebra. They are the building blocks of your knowledge. And take the time to learn about your health. Not from the easy fixes, the 7 tips here and the 10 tips there, but from the real foundation of what we know at this time about the human body and how it works. Because guess what? It's changing all the time, but it's built upon a foundation.